Good morning, everyone. Um, I've actually been wanting to do this talk for quite some time because there's a lot of patients calling with concerns about implants and specifically textured implants and the recent recall of all textured implants by Allergan, which is one of the three main companies that manufacture breast implants in America. The recall is surrounding textured implants. And just real quickly, textured implants have a rough surface on the outside, and textured implants are designed and engineered so that it holds on and it sticks to the tissue. So it does have benefits in certain patient populations, such as breast reconstruction patients. And then there are smooth round implants where on the outside there's no texturing, it's nice and smooth, and that's why these are called smooth round and these are called textured. On the inside they're both filled with silicone. It's just really what's on the outside or the shell of the implant that is different. And texturing came about mostly because of two reasons. Number one, you don't want a smooth round implant constantly spinning in a pocket and stretching out the tissue, such as in breast reconstruction. The second reason for texturing is there has been some papers that have shown that texturing leads to less encapsulation. So these patients who have textured implants presumably have a lower rate of capsular contracture, which is a thick scar that forms around the implants. So this implant, unfortunately, have been associated with what's called BIALCL. And BIALCL stands for breast implant associated anaplastic large cell lymphoma. So it is a lymphoma that is associated with breast implants. It's only been associated with textured implants. So to my knowledge, there has not been a smooth round case. Overall, the risk is somewhere around 1 in 16,000 to 1 in 30,000 if you have a textured implant. So it's not very high. The FDA is not actually recommending patients who have textured implants run to their plastic surgeon and get them exchanged out. That obviously is an option that patients have, but from the FDA standpoint and also from my standpoint, I don't recommend that patients all get their textured implants switched out. If they wish to have that done, I'm more than happy to do it for them, but your overall risk of developing ALCL is between 1 in 16,000 and 1 in 30,000. So, another important point for I think everybody to understand is a very treatable lymphoma, and it's only a surgical treatment. So there is no chemo, there is no radiation. If a patient develops ALCL, it's most commonly in terms of symptoms, some swelling in the breast, and then there's some fluid in the breast pocket. So that fluid gets sent off for analysis, cytology, meaning they look at the cells. And if there is ALCL, then the implant gets removed and the entire capsule gets stripped. So that all gets removed. It's a surgical treatment. And then a smooth round implant gets placed, and then presumably the patient is cured. So it's very treatable, very curable. Overall, not a very high incidence in terms of it occurring even if you have a textured implant in place. Obviously, it sounds very scary, but if you really look at the statistics, it's not something where if you have a textured implant, 50% you're going to get ALCL, 20% you're going to get ALCL. No, it's actually less than 1% if you have a textured implant. So any patients of mine that underwent a straight cosmetic breast augmentation, I always used a smooth round implant for a number of reasons. Number one, it's cheaper. So it is actually half the cost of what this implant is. Number two, it is a smaller incision to put this implant in versus an anatomic shaped gummy bear implant in. So the incision is smaller. And then number three, this implant is smooth, it's round, it can spin forwards, backwards, and no matter which way it actually faces, it's always going to produce a very similar result. Whereas if this implant rotates or spins, it can cause a deformity. So for those three reasons, I have always, for breast augmentation patients, used smooth round, because I think that there's very little benefit with this implant for just a straight augmentation. Now, for my breast reconstruction patients, I have used a lot of these anatomic textured silicone implants, and for good reason. So the first reason is they have a shape. So after you have a mastectomy, you're basically left with loose skin and that's it. So putting in a smooth round implant is less optimal because there is less shape. You see how this is shaped like a teardrop. This is round, so you get a better reconstructive result. This is also form stable, so it has a shape that stays in place because of the texturing, so that the reconstruction also stays in place, and it gives you a very defined reconstructive result. And so that's the reason why I have used a lot of textured implants for my breast reconstruction patients. So if you're one of my breast reconstruction patients that desires to have this removed and exchanged for a smooth round, I'm more than happy to do it for you. These implants are actually not even available anymore in the United States because Allergan has recalled them. Now, the two other implant companies have not recalled their textured implants, so you can still use them. But actually, about a month ago, our practice decided to stop using this textured implant in our breast reconstruction patients even before this recall happened last week. And it was mostly because of the anxiety that was being seen in a lot of the patients who were becoming more and more aware of ALCL. So if you have any further questions, I'd be more than happy to answer them. You can call the office to get more information. We actually have printouts for all of our patients that go through all the statistics, but hopefully that was helpful.